The coronavirus outbreak has already taken over the world. Even the developed countries are overwhelmed with numerous cases in hand. More so to the least developed countries. The socio-economic effects in LDCs will make them more vulnerable. To understand more, here are the top 5 challenges faced by LDCs during COVID-19 pandemic. Number 1. Shortage of medical supplies and equipment. Unlike other countries with state-of-the-art healthcare systems, LDCs struggle as they run dangerously low on personal protective equipment and medical supplies. In the Philippines, some frontliners are forced to use trash bags as PPEs. Healthcare professionals are getting infected as well. 17 Filipino doctors died due to the virus as of April 3rd. Number 2. Social distancing, a big challenge. High population is common amongst LDCs. Dhaka, Bangladesh, being the world's most densely populated city, has around 5,000 slums where 2.5 to 4 million people reside. Least likely to be tested, these people have the highest exposure to the mass population through their daily work as rickshaw pullers, housemaids, waste management, and others, creating an endless chain for the virus to spread. Number 3. Lack of health facilities. Mali only have 1 ventilator per 1 million people, with about 20 all in all, according to African Centers for Disease Control and Infection. Kenya is also reported to only have 550 ICU beds, with a population of more than 50 million people. Moreover, Africa's relatively weak health systems have already been compromised by Ebola and other diseases. Number 4. Fragile economies. In Myanmar, dozens of garment factories closed, leaving thousands of Myanmar laborers jobless. According to government officials, Myanmar is losing $16 million a day in border trade with China due to travel restrictions aimed at curbing the virus. Number 5. Aftermath of war and conflict. Many of the LDCs are still suffering from the effects of war and conflicts. In Burkina Faso, West Africa, the 700,000 displaced Burkinabé are faced with bad living conditions and crowded places in refugee camps, making them very vulnerable. With all these challenges, what actions could be done to lessen the negative effects to vulnerable countries? The United Nations Secretary-General Antonio Guterres appealed to the G20 countries.
We must declare war on this virus. Preventing the further spread of COVID-19 is a shared responsibility for us all.
The UN also launched a $2 billion global humanitarian response plan to most fragile countries, to establish a response mechanism and mobilize resources to ensure that developing countries have equal opportunities to respond to this global crisis. In addition, the World Bank Group has also approved an increased $14 billion package of fast-track financing to assist companies and countries. For actions to be taken by LDCs, the World Health Organization expanded this in 6 actions to contain the virus. First, expand, train, and deploy healthcare workers. Implement systems to find suspected cases. Ramp up production of tests and increase availability. Identify facilities that can be transformed into coronavirus health centers. Develop plans to quarantine cases. There should also be coordinated and cooperative action, as a country cannot fight without its people. Finally, each individual holds the key in suppressing this virus, so we need to be proactive too. Act accordingly by not leaving the house, wearing a mask, and keeping distance if one were to go out. We also need to disinfect our houses and to assume that the outside is contaminated. In this way, you are saved from further infection and you save others too from potentially being infected. And second, if applicable, we should go digital. Online banking and transactions, meetings, digital work, and others could be safely done digitally. In this time of pandemic, LDCs are not just facing health crisis but socio-economic crisis as well. We all should work with empathy, hand in hand, to suppress further deep effects this pandemic could bring.